If you're over 65, your doctor has probably told you that certain annual checkups are essential. But here's the hidden truth. Some of these so-called preventive tests can actually do more harm than good. Every year, millions of seniors line up for these exams thinking they're staying safe. But the reality? They can lead to unnecessary treatments, risky surgeries, and even life-threatening complications. And the most shocking part? New studies reveal that up to 37% of these tests in seniors result in unnecessary medical interventions. And 99% of people over 65 have no idea they're being over-tested. In fact, the #1 test on our list carries the same cancer risk as drinking alcohol every single day. And yet, it's still being recommended to healthy seniors. Today, we're uncovering the 5 annual health tests after 65 you may want to think twice about, backed by real science and real patient stories you won't believe. Let's start with the bone density scan, or DEXA scan. It's painless, quick, and promises to tell you how strong your bones are. But here's the reality. After 65, this test almost always finds something wrong, even when your bones are perfectly healthy for your age. Why? Because losing bone density is a natural, universal part of aging, just like getting gray hair or wrinkles. Doctors, however, often interpret these normal results as a medical problem and prescribe strong medications like bisphosphonates. And while these drugs can help certain high-risk patients, for healthy seniors, they can cause more harm than good. Jawbone necrosis, severe esophageal irritation, and even unusual bone fractures. A study in the Journal of the American Geriatric Society tracked over 1,200 women aged 70+. Result: the medication reduced fracture risk by just 0.3% in 5 years, a number so small it's statistically meaningless for most people. Now, let me give you 3 real-life cases. Helen, 72. A retired librarian with no history of fractures. She was put on alendronate after a routine scan. Within months, she had painful acid reflux and jaw discomfort that made eating difficult. After stopping the medication and focusing on diet, exercise, and vitamin D, she felt stronger than before. David, 69, a former construction worker. His scan showed osteopenia, mild bone loss. He refused medication, instead joining a senior strength training group. 2 years later, not only had his bone density improved, but his balance reduced his fall risk dramatically. Maria, 75, she had a scan, was prescribed bisphosphonates, and ended up with a rare femur fracture caused by the medication. Surgeons had to place a rod in her leg. These are not isolated incidents. The takeaway: if you've never had a fracture, have no severe risk factors, and are active, you may not need this test at all after 65. Lifestyle changes like resistance training, balance exercises, and nutrient-rich foods, leafy greens, dairy, sardines, are proven to lower fracture risk by over 20% without a single pill. Quick question for you. Have you ever had a bone scan? What did your doctor recommend after? Let me know in the comments. I read every single one. Let's move on to the brain MRI for memory complaints. Imagine you've been forgetting names or misplacing your glasses more often. You worry. Is this dementia? Your doctor orders an MRI just to be safe. Here's the problem. In people over 65, these scans almost always show age-related changes, slight shrinkage, harmless white spots, things that are completely normal. In 2021, a study in Neurology Today reviewed 3,000+ MRIs in seniors with mild memory complaints. 86% showed some abnormality, but only 3% were linked to a treatable condition. Worse still, 12% of these patients went through invasive follow-ups, spinal taps, even brain biopsies, only to find nothing serious. Now, here are 3 stories that show why this test can be more harmful than helpful in mild cases. Robert, 68, retired engineer. His MRI showed white spots. He panicked, convinced he had dementia, and withdrew from friends. Months later, cognitive testing proved he was fine. He just needed better hydration and sleep. Elaine, 70. She had an MRI after occasional forgetfulness. The scan found a tiny benign cyst, but doctors pushed for monitoring every 6 months. Each scan made her anxiety worse. She started avoiding social activities, fearing decline that never came. Frank, 73, had mild memory issues due to B12 deficiency, but his MRI led to unnecessary neurology visits before anyone checked his blood work. The truth is, for mild memory problems, the best first step is a simple paper-based cognitive screening test. It's quick, cheap, and accurate, without the emotional toll of ambiguous scan results. If you're experiencing severe symptoms, like sudden confusion, seizures, or personality changes, then yes, imaging is essential. But for everyday forgetfulness, often better sleep, hydration, exercise, and brain activities like puzzles or learning a new skill can stabilize or even improve memory. Number 3, the cardiac stress test. This is where you walk on a treadmill or take medication to simulate exercise while doctors monitor your heart. It's useful if you have symptoms of heart disease, but in healthy adults over 65, it can be a dangerous gateway to unnecessary procedures. The false positive rate can be as high as 40% in this age group. That means many seniors are told they might have blocked arteries when they don't, leading to angiograms, stents, or even bypass surgery with no improvement in lifespan or quality of life. In a major JAMA cardiology study, more than half the stents placed after stress test referrals were in patients with no real benefit. Let's look at 3 examples. Margaret, 70, mentioned mild fatigue to her doctor. A stress test suggested a blockage, leading to catheterization and a stent. She reacted badly to the dye, ending up in the hospital for a week. Her original fatigue? Caused by anemia. James, 74. His test flagged an abnormality that turned out to be an artifact, a false reading. But by then, he'd undergone angioplasty. Olivia, 68, an active hiker. Stress test led to more testing, more bills, and more anxiety, with no real heart problem found. Safer alternatives for those without symptoms include a resting EKG or a coronary calcium scan, lower risk, lower cost, and fewer false alarms. Number 2, colonoscopy. While life-saving in younger adults, after 65, the balance shifts. The prep is harsh. Strong laxatives can cause dehydration, dizziness, and kidney issues. Sedation increases confusion and fall risk, and the procedure itself can cause bleeding or bowel perforations. In a study of 1.3 million Medicare patients over 75, only 2 lives were saved per 1,000 colonoscopies. But 20+ had serious complications. 3 cautionary cases. Linda, 69, healthy, no symptoms. Colonoscopy caused a bowel perforation. 10 days in hospital. Edward, 72, developed severe dehydration from PrEP, leading to hospitalization. Susan, 76, had cognitive decline after sedation, taking months to recover. If you're in good health and have a history of clear colonoscopies, consider safer options like the FIT stool test. Done at home, no PrEP, and still highly effective at catching dangerous cases. And finally, the most dangerous overused test, the annual full-body CT scan. Marketed as the ultimate preventive tool, It delivers 10 to 20 millisieverts of radiation, the equivalent of 500 chest X-rays. A 2023 JAMA internal medicine study estimates up to 5% of all U.S. cancers may now be linked to medical imaging radiation. And here's the trap. These scans often find harmless nodules or cysts that trigger a cascade of more scans, biopsies, and surgeries, many unnecessary, some dangerous. Cases: Paul, 72. Scan found a tiny lung nodule. Biopsy collapsed his lung. Nodule was benign. Janet, 69, had repeated scans for a harmless liver cyst, spending thousands and living in fear for years. Thomas, 75, scan led to unnecessary kidney surgery. Pathology later showed the tumor was scar tissue. The American College of Radiology says these scans should never be used for screening in symptom-free adults. Instead, focus on targeted imaging when there are real, specific symptoms. So here's your safe screening checklist after 65. Blood pressure checks. Basic blood tests. Annual cognitive screening vision and hearing tests. Imaging only when symptoms demand it. Sometimes, less is more in medicine. Always ask your doctor, if this test finds something, what happens next? If the answer is unclear or the risks outweigh the benefit, it might be time to say no. We are Senior's Guide. If you found this video helpful, hit like, subscribe, and share it with your friends and family so they can avoid these dangerous mistakes too. And don't miss my next video on 7 everyday foods that secretly raise your blood pressure after 60. It might surprise you.